Treated mental health issues are packing people in jails, homeless encampments, and often worse. Lawmakers in both parties are trying to tackle the issue, but they're getting questions about whether a bill they're pitching is enough. 11 Alive's Doug Richards is looking into what it covers.
In an election year, the mental health bill introduced by the Republican House Speaker and backed by Democrats has enjoyed rare bipartisan support. But even supporters say it only goes so far. The tents set up by homeless folks less than a block away from the state capitol give lawmakers a daily look at some Georgians facing mental health crises. Police say 911 calls are often rooted in mental health more than criminal crises. All that inspired Republican House Speaker David Ralston to introduce a mental health bill co-sponsored by Democrat Mary Margaret Oliver.
Speaker Ralston's bill really focuses on crisis intervention for the families that need the most help in the most desperate situations.
I'm going to give Republicans credit. One Republican.
Democrat Stacey Abrams, a candidate for governor, told an audience last week the mental health bill has one deep flaw.
The problem is we can't pay for the bills we're passing if we don't expand Medicaid. We are making promises we cannot keep unless we invest.
Ralston's mental health bill does not expand Medicaid under the Affordable Care Act. Republicans in Georgia have vowed never to do it. But Oliver says the bill does provide $127 million to fund mental health crisis treatment, including state funding for crisis beds at treatment centers, while including Georgia in a 988 national crisis hotline. It also funds mental health training for law enforcement. Oliver says it will not eliminate an insurance gap that Medicaid expansion could address.
People with insurance will have a little bit easier path, but people without insurance are going to get new treatment options for the crisis that they're facing.
Oliver says despite Republican opposition, Medicaid has expanded in Georgia somewhat under COVID emergency guidelines. That, she says, will give the mental health bill more heft if it passes. At the Capitol, Doug Richards, 11 Alive News.